Attrition rates low, how to get Malaysians to show up for their appointments, and reduce capacity for public transport. Will this counter social distancing objectives? That's coming up. We need to prepare for the worst. Health Director General Tan Sri Dr. Noor Hisham Abdullah told Malaysians following a surge in COVID-19 infections that may trigger a vertical surge. In a Twitter post, he outlined the surge in COVID cases following an exponential trend since the start of April. A record 7,289 new infections were recorded in the past 24 hours, with Selangor once again reporting the highest number of daily cases at 2,642, followed by Johor, Kuala Lumpur and Sarawak. 60 deaths were recorded today. New COVID cases have stayed above 6,000 for 7 straight days. The Health Ministry has said the tally may exceed 8,000 by June if people don't follow SOPs. Dr. Noor Hisham urged Malaysians to stay home and comply with the SOPs to break the chain of infection. Next round registration for the opt-in AstraZeneca vaccine will be open for those under the age of 60 tomorrow. Coordinating Minister of the National COVID-19 Immunization Program, Khairi Jamaluddin, said slots will be available for booking at 12 p.m. He, however, stressed that the elderly will still be prioritized when assigning slots for vaccination. Khairi added the new SOP issued immediately for vaccinators to show the syringe with the correct dose to the recipient receiver before the jab. This is in light of allegations that certain individuals were given a lesser dosage of the AstraZeneca vaccine compared to the required dosage. Meanwhile, according to Khairi, there are several factors leading to the possibility of herd immunity being achieved before December. These are the mutation of the virus variants, effectiveness of existing vaccines, and ensuring those who are not registered are immunized. A new feature under the MySejahtera application will be launched soon that will enable pregnant and breastfeeding mothers to register for COVID-19 vaccination. The group can identify themselves when they register for appointments and for the recommended vaccines to be given to them. Khairi said that the vaccine committee will also decide this Thursday if pregnant mothers can be administered with the AstraZeneca vaccine. Pregnant and breastfeeding mothers have been advised to consult their doctors before going for vaccination. Khairi says states can get direct donations of COVID-19 vaccines so long as they are genuine and legitimate. He clarified that vaccine supplies through Putrajaya is just one of the options available and that the state governments could source their own as long as they're approved by the National Pharmaceutical Regulatory Agency and need not go through the federal government. One of the reasons why thousands of senior citizens, especially in Kelantan, missed their vaccination appointments after being registered on the MySejahtera app was due to not being properly informed. Professor of Geriatric Medicine at University Malaya, Prof. Dr. Tan Maupin, said this proves that a lot more should be done to get the Malaysian population vaccinated.
So number one, if you want to continue using the MySejahtera as the only means of actually administering this appointment system, then you will build in that attrition rate, and it will vary from state to state because Kelantan is more rural and therefore places are not so accessible. Or you could actually do it totally differently in these places where there are high attrition rates. Now we know what works in Kelantan is word of mouth. So we could actually, and it's a low density area, you could turn up to a kampong and you could actually tell the ketua kampong you're coming on this and this date, round up all your villagers, and we will do it. Yeah, so no one size fits all solutions. If you want really, if you're fully committed into actually vaccinating the whole population, you've got to have various strategies. I think that the way that AstraZeneca is being done is a really good idea as well. People log in and choose a time that they can do. So there are various ways, and because we have modern technology, as soon as it's gone in your arm, if I have your IC number, it's very unlikely that you are going to end up with more than 2 doses of the vaccine. So we need some sort of trusts. We need to uncomplicate the system. and we really need to have more flexible. Yeah, so because it is very inconvenient at the moment. You're suddenly called, you have a full diary the next week, all these appointments, and suddenly you have to cancel all your appointments to go for your vaccine. Now, what if an emergency happens? So to be able to choose when you want to go is actually quite a good thing to do.
In light of the emergency, the Sarawak government will continue to function even after the State Assembly's tenure expires. This follows an audience granted by the Yang di-Pertuan Agong Al-Sultan Abdullah Riayatuddin Al-Mustafa Billah Shah to Chief Minister Datuk Patinggi Abang Johari Tun Openg at Istana Negara earlier today. In a statement, the Chief Minister's office said the King and the Sarawak Governor will decide when the State Assembly will be dissolved. This is based on the advice of the Attorney General, the Election Commission, the Health Ministry, Police and Armed Forces. The tenure of the current State Assembly would automatically end on June 6, with the state constitution requiring new elections to be called within 60 days of the dissolution. However, elections are banned under the state of emergency, which is in force until August 1st. We'll take a short break. Stay with us.
Kabar baik untuk semua rakyat B40. Dengan Yes Prihatin belajar dari rumah, Yes memberikan telefon pintar percuma dan data percuma. Tiada deposit, tiada kontrak, tiada bayaran. Ini memang milik anda. Tuntut sekarang di yes.my/kasih-up B40.
Welcome back. Yesterday, Malaysia was shocked by a rail accident at the Kelana Jaya line. A passenger train collided with an empty train while doing its test run. In spite of that, this morning, rail services resumed operations with pictures shared across social media of packed carriages. With new SOPs announced under the MCO that reduces the passenger capacity in public transport by 50%, how do we address overcrowding in trains? We speak to Wan Agil Wan Hassan, former head of Operation Group at Policy and Planning in the now defunct Land Public Transport Commission, on current procedures.
Public transport system in the country, especially in KL, it's already overcrowded, especially on the LRT Kelana Jaya line. With the SOP practiced by the public during this pandemic situation, it will make it even worse because the recent SOP, government already asked for the public transport operator to reduce the capacity to 50%. And the problem here is that it's not only capacity has been reduced, but the frequency of the service has also been reduced. That's the real problem because we have the same amount of passengers or probably reduced amount of passengers, even though we only have 40% of the private sectors working from home and the other 20% of the government sectors working from home. We still have many passengers traveling using public transport. So it's not that they don't want to comply to the SOP, but the situation didn't allow them to comply to the SOP. Then the incident yesterday is to make it even worse when the Kelana Jaya line has an accident between the rail with passengers and the train without the passengers. It's disrupt the whole line services. And we can see the outcome of it this morning when everyone just traveling on train like a normal situation.
Wan Agil suggests for the frequency of the train to be increased, especially during peak hours, in order for passengers to better practice physical distancing.
The objective of the government is to reduce the physical contact. You need to have more space in the train. Rather than reduce the frequency, you need to increase the frequency. You can just reduce the frequency during off-peak. This is when people are not going to work. It's between 10 o'clock to maybe 4 o'clock in the evening. But increase the frequency during morning peak. Rather than having a 3 minutes frequency, maybe you can increase it to 2.5 or maybe 2 minutes frequencies. Then you can have more trains during morning peak. And people can just traveling with acceptable physical distance as per the aspiration by the government.
The unfortunate rail accident yesterday saw 47 people severely injured and hundreds suffering minor injuries. Wan Agil believes that Prasarana should be transparent and carefully deal with the situation at hand to earn public's confidence and avoid future accidents.
I believe that this is something that Prasarana need to really carefully deal with and need to communicate with the government, especially with the MOT and APAT, to understand the real reason why is this happening. And if Prasarana is the one who is responsible in this accidents, I believe they need to take full responsibility in compensating the victims. And they need to be transparent on full audit of the system. I think rather than have investigation about the accidents, we need the public to be comfortable enough to travel by public transport again by having a full audit on the technical, especially on the rail services. Then it will give more confidence to the public.
On the international front, less than 2 months before the start of the Tokyo Olympics, the United States warned Americans against travel to Japan due to a surge in COVID-19 cases in the country, which has forced several states to declare a state of emergency. Japan's borders have been closed to most non-resident foreigners since the early months of the pandemic. But the warning is another blow for the Olympics, which are facing opposition among the Japanese public over concerns that the Games could become a super spreader event as athletes and their entourages pour in from around the world. The Japanese authorities have insisted that they can carry off the Olympics safely, but it is still grappling with problems such as allocating medical resources and protecting volunteers. The Japanese government insists the U.S. travel advisory won't impact the Olympics, which it said will go ahead as planned on July 23rd. Taiwan has extended its heightened COVID-19 warning level until the middle of June, even though the trend in new infections is falling. Millions of vaccines are also on the way as the island nation deals with a spike in domestic cases recently. The situation is exacerbated by a low vaccination rate of only about 1% of its 23 million population. Taiwan has ordered more than 20 million doses from AstraZeneca and Moderna and is also developing its own vaccines. Australia's second largest city, Melbourne, reinstated COVID-19 restrictions today. Home and public gatherings will be limited and face masks will be mandatory indoors. Authorities are scrambling to find the missing link in a fresh outbreak that has grown to 9 cases. Opinion polls show vaccine hesitancy has risen sharply in Thailand, just weeks away from the start of a mass inoculation drive. Reasons for the rise in vaccine hesitancy were unclear, but there were widespread complaints at the government disorganization and reliance on Sinovac and locally made AstraZeneca doses. Thailand aims to inoculate 70% of its population by year-end. The European Union has agreed to ramp up sanctions against Belarus, a day after the government in Minsk forced a passenger plane to land to arrest an opposition journalist. Airlines such as Air France, Finnair and Singapore Airlines became the latest carriers to suspend flights over Belarus after EU-based airlines did the same. Belarus President Alexander Lukashenko sparked international outrage on Sunday after his government dispatched a fighter jet to intercept a Ryanair flight flying over its airspace to detain a 26-year-old reporter. Belarusian officials have reiterated that the plane had to be grounded because it faced a bomb threat on board. The Ryanair flight flying from Athens, Greece to Lithuania was diverted off course while flying in Belarusian airspace and landed in the capital Minsk. U.S. President Joe Biden condemned Belarus's action and called it an outrageous incident. Although COVID-19 primarily manifests as a respiratory syndrome, its reach can extend to many other organs with devastating consequences. Tonight on Consider This, we ask our guests why nearly 1 in every 100 COVID-19 patients in Malaysia dies. That is all we have for you on AWANI Tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Saraya Mia. We'll see you again.